Are you having a UTI? A woman comes into the doctor's office and she's been reporting burning with urination, frequency of urination. She's going to the bathroom quite a few times in the day just to urinate. And she's having new incontinence and pelvic pain. Is she having a UTI? Hi, I'm Dr. Naznin Jamal. I'm board certified in internal medicine, and my goal is to empower you on basic medical diseases and concepts. So let's begin. Urinary tract infections, also known as UTIs, are basically a collection of symptoms from the inflammation in the bladder wall caused by bacteria. Common symptoms include burning urination, urinary frequency goes up, pelvic pain, and sometimes new incontinence. Flank pain with fevers and chills is less common in a urinary tract infection and can indicate a kidney infection or sepsis. Flank pain by itself can indicate a kidney stone often. And then blood should not be present in the urine unless a woman's on her menstrual cycle. But if she's not on her menstrual cycle and she's having blood in the urine, then that can indicate other disease. Women are more likely to develop urinary tract infections than men just because of the differences. The female urethra is shorter than the male urethra, and because of that, they're prone to having more infections. Now, if your physician suspects you're having a UTI, they're going to collect your urine and send it to the laboratory, where they will evaluate it for the presence of white blood cells, bacteria, and other chemical findings. The color of the urine doesn't indicate a urinary tract infection. It can be light to dark. Dark urine usually indicates dehydration, and it can be also an indicator of insufficient water intake. Now, let's say the specimen shows that you have a urinary tract infection. Your doctor will prescribe you antibiotics after they review your medical history and other medications and allergies. Now, let's say you don't have symptoms. You don't have symptoms. You had to give a urine specimen for a disease workup of some other part, some other complaint. Then you don't need treatment. If you don't have symptoms of genital urinary disease, you don't need treatment unless you are pregnant or about to undergo a urologic procedure in the bladder, a surgery of your urethra, bladder, or the like. Remember, antibiotics are powerful. They are designed to kill bacteria, but that comes at a cost to you, to your body. There's side effects, and one of the most worrisome uses of antibiotics is the development of drug resistance. Now, some physicians will opt for a treatment-based strategy. They have a relationship with their patients. These patients often are known to have very many urinary tract infections throughout the year, so they may call in the prescription without them having to come into the office, or they may call them in a supply for them to self-treat. And then some patients need to take a daily medication to help prevent urinary tract infections, but there's a side effect to that too. They can also develop drug resistance. So if you think you're having a urinary tract infection, call your doctor's office, let them evaluate you for a UTI. Until next time.